The Population Education Development Organization, or PEDA for short, is a legally recognized civil society organization designed for the implementation of community education and development in Laos. Initially, the organization was formed as a youth fellowship for action and development, commencing its program activities at the grassroots community level in August 2001 with 6 full-time volunteer members. PEDA is experienced in the areas of sexual reproductive health, HIV/AIDS, STIs, intravenous drug use, and human trafficking prevention. PEDA targets marginalized groups, including affected populations in urban and remote areas. Today, PEDA has 25 qualified core staff, including 2 technical advisors, all of who are experienced in the areas of sexual reproductive health, STIs, HIV/AIDS, malaria, tuberculosis, IDU, human trafficking, gender, nutrition, agriculture, and livestock through community-based intervention. PEDA envisions an educated and empowered community that is self-reliant and built on the principles of sustainable development. PEDA's mission is to bring the vulnerable and marginalized out of poverty through the delivery of targeted education and capacity-building programs, resulting in communities which are both self-reliant and sustainably developed.
PEDA's projects center on public education in and prevention of infectious diseases, one of which is malaria. Though malaria incidence rates have decreased over the last 2 decades, outbreaks still occur in some parts of southern provinces, especially those populated by ethnic minorities and migratory workers. Provinces with substantial cross-border movement are most vulnerable to these outbreaks. PEDA began working with the Global Fund in 2007 to advocate for these marginalized groups. PEDA's interventions include developing and delivering an education package centered on advocacy, communication, and social mobilization, including IEC-BCC, increasing bed net use, and enhancing early malaria diagnosis and treatment. PEDA has also trained village malaria workers in target villages across districts to regularly implement integrated community case management, ICCM, and collaborate with health centers, DAM, and PAM for outbreak and RACD responses, aiming to eliminate malaria in 2030.
PEDA aims to reduce the morbidity and mortality rate of tuberculosis in Laos. Tuberculosis is a serious infectious disease that mainly affects the lungs. If left untreated, it can lead to death. Various provinces in Laos have high risk groups due to their location and lack of access to information and support. Through peer educators, advocacy, and outreach work, PEDA was able to create a program that focuses on screening for tuberculosis, as well as referrals of suspected cases of tuberculosis. The project also focuses on identifying target villages, promotion of tuberculosis prevention, testing through mobile community outreach in order to collect samples, referral, and follow-up and support visits. PEDA also collaborates with the community outreach with ACMF in mobile and migrant workers in the Special Economic Zone.
PEDA also aims to reduce the infection rate of HIV/AIDS STIs with the goal of stopping HIV/AIDS in Laos by 2030. While anyone can get these infectious diseases, PEDA specifically focuses on high-risk and vulnerable populations such as out-of-work youth, female sex workers, and migrant workers. Additionally, women are at greater risk in part due to unequal knowledge between the genders. The issue is that people often don't seek testing until they are sick. PEDA aims to proactively reduce the incidence rate of HIV/AIDS in Laos by promoting peer education through peer-led intervention, snowballing, mobile test and treat, using RRTTPR for ensuring quality service delivery in target provinces, particularly where there are known to be significant numbers of female servicewomen. In addition, PEDA provides referrals and tracking for antiretroviral therapy adherence and STI diagnosis and treatment. The goal of reducing TB in Laos is tied to that of reducing that of HIV/AIDS because tuberculosis is the leading cause of death for people with HIV.
Recognizing that the severity of poverty has increased among the poorest population groups in Laos, PEDA has implemented the Nutrition Support and COVID-19 Response Project to improve COVID-19 education and emergency nutrition quality in the country's poorest districts. Part of the nutrition interventions implemented so far include mobile community education in nutrition, training peer educators, working with village health workers, and providing agricultural training and kitchen garden promotion to families. Each of these efforts aims to combat malnutrition and its effects, such as greater rates of stunting in children.